And our community's response to it. First, we want to acknowledge the reports that have come in on the first death of COVID-19 in Nebraska. A man in his 50s in Douglas County who had underlying health conditions passed away today, and on behalf of our entire community here in Lincoln, I want to express our condolences to his family and friends. This first death in the state of Nebraska is a sober reminder of why we are all working so hard to fight the coronavirus. I want to thank the people of Lincoln and Lancaster County for working with local and state governments to stop its spread. Since we issued the directed health measures on Wednesday, We've received many questions from residents and businesses who want to comply with these measures, and today we'll be answering some of those questions about the new measures and also talking about some changes that are coming out of our Parks Department. Joining me today are interpreter Sharon Sinkler, and thank you again for being here. From the Health Department, we have Interim Health Director Pat Lopez and Scott Holmes, who is the manager of our Environmental Health Division. Lynn Johnson is here from Parks and Rec, and standing by for questions are also City Attorney Jeff Kirkpatrick and Assistant City Attorney Rick Tast. The reason for these briefings is to provide the public with the most accurate, timely, and reliable information, and I want to thank the media for helping us to get this information out. I want to also remind everyone who is tuning in that we also have a website, covid19.lincoln.ne.gov, and that's another place where you can turn to for information about how to protect yourself, your families, your loved ones, and our community. We will do our best in these briefings to answer all of your questions and hope that you will understand that there may come a point at which there's a HIPAA privacy rule that may prevent us from providing all of the information and sharing certain types of information, but we are here to answer questions and provide you with everything we know. And with that, we'll talk about what we know and give you a bit of a situation update. At this time, Lincoln still has 3 lab-confirmed cases of COVID-19, 2 that are travel-related, and 1 that is community spread or community-acquired. Just to remind our viewers, community-acquired or community spread refers to cases in which an individual has COVID-19 but has no relevant travel history and no identifiable exposure to the virus. At Lincoln and Lancaster County Health Department, we currently have 181 negative tests for COVID-19 and are currently have 10 tests that are pending results. The Health Department is also monitoring 179 individuals. The number of cases in our state now totals 82. Local testing continues. Bryan Health has had about 165 people come through its drive-through site over the last 3 days. 144 individuals had samples taken to be tested for COVID-19, and results are expected in the next several days. I want to note that in order to access Bryan Health's drive-through testing at the LifePoint location, each person needs to make an appointment and have a doctor's order in order to be able to be tested. Patients can obtain that order from their primary care provider, or they can visit a website that Bryan Health has stood up called bryanhealth.org/EZ-visit. That's the letter E, the letter Z, visit. And those are required in order to participate in that testing. CHI St. Elizabeth's will have an additional drive-through testing site operating by the middle of next week. It'll be in North Lincoln and will operate very similar to the Bryan LifePoint site. In addition to the work that our hospitals are doing, private lab results are now coming in daily, all of which is greatly increasing the number of reported test results to our health department, and that's a good thing. But we do know that as our access to testing increases, and as this virus moves through our community, the number of positive cases is likely to grow. The United States now has more cases than any other country. And the CDC reports today that there are over 85,000 cases in the U.S. and more than 1,200 Americans have died. The implications of these sober numbers are that every American city is at risk and strong mitigation measures are needed urgently. So without medications and vaccines at this present time, our best tools are identification and isolation of the sick, quarantines for the exposed, and other social distancing measures. Every day matters in this fight, and I encourage everyone to take the recommended social distancing measures seriously now. Not tomorrow, not this weekend, but now. Social distancing, staying at least 6 feet away from others, is more than a recommendation. It is a must as we fight to flatten the curve. That is how we buy time for new therapies, new vaccines and treatments that will move through the development pipeline and help us fight this virus. These realities and the identification of Lincoln's first community-acquired or community-spread case led the Lincoln and Lancaster County Health Department to order the directed health measures on Wednesday. The measures were based on guidelines that we had established with UNMC infectious disease specialists and with the governor's office. And I have here today Interim Director of the Health Department, Pat Lopez, to review again what the directed health measure means for our community and to spell out and clarify some of the questions that people have been asking.
Good afternoon. As the mayor said, since our first confirmed case, which was related to travel on March 20th, and our subsequent case that was related to that first individual, on Wednesday, March 25th, we announced our third case. That was a community-acquired case. And based on that and the recommendations from the governor and UNMC, we implemented directed health measures similar to what was implemented in Omaha. And I want to emphasize these measures are implemented to protect the public's health and prevent the spread of the disease. So what really this means is any gathering of 10 or more patrons, customers, or other invitees, excluding staff, in a single room or a single space at the same time in a confined indoor or confined outdoor space is prohibited. Any gathering of 10 or fewer patrons or other invitees with a minimum distance of 6 feet between all individuals cannot be between all individuals that cannot be maintained in a venue is prohibited. This applies to, but is not limited to, body art facilities, barber shops, beauty shops, nail salons. If a venue is subdivided into multiple spaces separated by either physical walls or sufficient airspace, each subdivided area may contain up to 10 patrons, customers, or other invitees, excluding staff. Alcohol sales are restricted to carry-out sales and delivery only to the extent permitted by law. No on-site consumption of alcohol is permitted. This includes bars, taverns, private clubs, regardless of the name or characterization. Food and beverage sales at restaurants, bars, taverns, private clubs, and dine-in establishments are restricted to drive-through, carry-out, and delivery only. This does not apply to food services and healthcare facilities. And I just want to mention, since we implemented the measures, yesterday we received 90 calls from individuals questioning primarily restaurants and bars, as well as others. And today we've received 7 calls. There have been an increased number of entries into the uplink, which I think the mayor will talk about here in just a minute. So we've had, our community is responding in a very positive way, and we are making every attempt to address questions that we have from these bar and restaurant owners, as well as those others whose businesses have been impacted.
As Director Lopez said, we are asking folks that believe they're folks out of compliance with the directed health measures to report those through the Uplink app or through the Uplink link that is on our website. That is so that we can keep our police non-emergency line clear for things that the police need to deal with more urgently. Again, the first line of enforcement for this directed health measure is actually the health department. And so if we learn of folks who are not in compliance, health department officials will go out and try and provide the education necessary to help people comply. We know that this is in this new phase, things are getting more difficult for people, and we have to just keep emphasizing that the top priority for all of us is to protect the health and safety of our residents, and particularly those most vulnerable to this virus. We can do that by flattening the curve and preventing the rate of infection and keeping our healthcare sector from becoming overburdened. All of us are making sacrifices to defeat this virus and save lives, and what we are doing now matters. So let's talk about what we're doing now. Some additional things we're doing now to protect our community here through our actions at City Hall and working with our community partners to be part of the solution. First of all, we're communicating, and communication is vital information about how people can protect themselves and their families in our community is key. In addition to these briefings, we are continually updating and providing the latest information to our website at covid19.lincoln.ne.gov. And since we launched this site on March 16th, it has had nearly 77,000 visitors. That's about the same amount of traffic our city's main site gets in a month. We've also sent email updates to the thousands of people who have subscribed to this page, and we encourage you to subscribe too. The health department has worked to even bolster the staff who are answering its hotline. That health department hotline for questions related to health and the coronavirus is 402-441-8006. There are now an additional 14 nurses helping to staff that hotline. The health department is also fielding questions, as Director Lopez said, through a different number at the health department. For questions about the directed health measures and how to comply with them, please call 402-441-6280. Again, that number at the health department for complying with directed health measures is 402-441-6280. Here at City Hall, we're also working closely with our business community, our advocates for those who are experiencing homelessness, landlords and property owners, and our nonprofits. Our health department continues to work closely with healthcare providers and long-term care and assisted living facilities. This is truly a whole community effort. And we are working here at City Hall to provide stability to the 2,150 residents who work for the city to provide services. We're also coordinating regularly with the governor's office and infectious disease experts at UNMC, and we plan to share more with you about all these activities in future briefings. We're going to make these more regular and move to a daily format starting next week. We also have some good news regarding Lincoln's COVID-19 Response Fund. That was an effort of the City of Lincoln, our philanthropic and community partners, to provide a place for those who want to help to donate and help distribute resources rapidly to nonprofits who are serving our most vulnerable residents. I'm pleased to say that that fund has now raised nearly $653,000, and I'm grateful to all who've contributed. And if you are able, if you're in a position where you can contribute, we'd be so grateful if you would consider that too. You can do so by going out to lcf.org. If you are not able to, but you are a nonprofit that needs to bolster capacity in order to serve the most economically vulnerable in our community, you can go to lcf.org as well. The initial grant application is now available. And nonprofits wanting to apply can fill out an application online, and the first round of awards will be made in the coming weeks. So thank you again to all who've contributed. Thank you to the committee members who are making that happen, and of course to the Community Foundation and United Way for being such significant partners in this effort, along with the Community Health Endowment. Our individual city departments are also making many changes to help prevent the spread of the coronavirus. Those changes are all posted on our website at covid19.lincoln.ne.gov. But today we want to highlight a few changes you'll be seeing in our city parks. With school out and more residents needing to get out of their homes just for a breath of fresh air, they're spending more time in our parks and trails. It's a good way to do it if you can keep the social distancing measures in place. The parks are a great resource for us all in this time. But it's still extremely important to follow the recommendations of the health department, and earlier today Parks issued some new guidelines about how to enjoy our parks. So here to speak to those is Lynn Johnson, the Director of Parks and Recreation Department.
Thank you, Mayor. We think that the message really is be active and be safe. And we do want to encourage people to be outside, and I would tell you that we have seen probably an increase in people in our parks and on our trails. Some guidance that we're providing at this point is that if people are not feeling well, if they're symptomatic, if they've got a fever, if they've got a cough, if they have shortness of breath, that we're encouraging them not to get outside and not to be in parks and trails. We've implemented a measure where we're discouraging people from playing on playground equipment. Those are high-touch surfaces that are not sanitized. So we're encouraging people not to play in those areas. As the health department has continued to advise, we need to maintain good social distancing. So maintain a 6-foot distance between you and others, and also make sure that when you're in places like basketball courts or pickleball courts or tennis courts, keeping the group size to less than 10 people, and also making sure that there is good social distancing between those people. Be prepared when you go out. People need to recognize that restrooms are not going to be available and that drinking fountains are also not available. So we encourage people to bring water with them when they go out, and to also bring hand sanitizer with them as well. We're encouraging people to pack in and pack out, pack their trash out with them after visiting a park or trail. We're seeing a lot of dogs out in parks, which is a good thing. And we want to just remind people that dogs in parks are supposed to be on leash, with the exception of our 4 fenced dog runs. And we also remind people that there is a city ordinance that people need to pick up after their pets when they're out on trails or in parks. We want to remind people that the trails in the Pioneers Park Nature Center are not open to pets. We want to make people aware that our golf courses do continue to be open. We are having modified operations there. A new measure that we just implemented today is that all of our golf carts are single rider. You can certainly get information about the golf program by going to lincolncitygolf.org, and there's information at that site about the measures that we have in place at golf courses. And we're also encouraging people to pay in advance, and that minimizes the time they have to be in the clubhouse. So again, as the mayor said, we think this is a great time for people to get out, be active, but be safe as they're out in our parks and on our trails.
Thank you, Lynn. As part of our response efforts, I am participating in a weekly Zoom meeting with over 140 mayors from across the country, and we're joined by medical experts from Johns Hopkins University, and they're sharing insights about some of the most effective work that's being done to defeat the novel coronavirus, and it's been heartening to hear about some of the work. I just wanted to share a little bit of that with you. There are dozens of biotech firms who are currently racing to innovate and develop a vaccine for COVID-19. The FDA has cleared the first serology tests, which basically are helping to develop a test to measure whether or not an individual has developed antibodies to COVID-19. And this is important because as we build capacity to test antibodies, we'll know more about who has recovered from the disease and therefore who is safe to return to work or to more normal patterns of everyday life. And really all this is just a concrete reminder that we are not stuck in this period of uncertainty forever. Innovation like this is also coming close to home. The University of Nebraska, we're seeing innovation that's being featured on shows like 60 Minutes and in the New York Times as they work to enhance our prospects for fighting this virus and allowing us to disinfect personal protective equipment and to augment our testing capacity. People in Lincoln are becoming innovative and working to use their 3D printers to try to turn them into tools in this fight. And I really just want to say that the ingenuity and the entrepreneurial spirit of the people of this city and state are going to be part of this solution as we face this challenge together. Before we take questions, I just want to again stress that those with questions about the recent directed health measure should call the health department's line number that is 402-441-6280. And again, that if you want to report what looks like non-compliance with those measures, to please use our Uplink app to do that. The health department will then receive that information and do the initial enforcement and education. With that, we'll open this up for Q&A, and ready to take those questions are a number of city staff along with myself.
Should we just ask questions? Okay. Can you hear me?
Yes.
Okay. So my first question is
what media you're with. Sorry, I can't see the text over your.
Oh, yeah. I'm with 1011. My name's Mackenzie. My question is about parks. We've received a lot of viewer tips about people still having large groups of people in parks. Do you have plans to either shut down parks, or how are you guys trying to monitor that?
Thanks for the question.
We definitely don't want to shut down parks because this is actually one form of respite for all the folks who are spending much more time at home. And it is safe to be outside if you practice social distancing measures and keep yourself clean and use good hand washing. I'm going to turn this question over to Lynn Johnson, though, because he can speak more to the idea about how operations have shifted at the parks.
Thank you, Mayor McKenzie. Thank you for your question. One of the other things that we have done is we are heading into the time of year when we get a lot of people who are reserving park shelters for family gatherings and family activities. We've reviewed all of the park shelter reservations between now and May 6th, and we've notified people that we are canceling those reservations and we're making refunds. If people want to reduce their group size to 10 or less, we're allowing people to resubmit those reservations. And again, this is really about messaging and about people complying with good guidance that we're getting from the health department about it's great to be outside, but we want to make sure that people are, as I say, maintaining good social distancing and that they're really monitoring the group size that they're in and keeping that relatively small. We agree. We think that this is a great place for people to be outside enjoying weather. It's part of your physical health. It's part of your mental health. So we want to make sure that we keep those facilities available to the community.
I think this one's for Lynn as well. It's Kent Walgamot from the Journal-Star.
Hi, Ken.
Hey, Lynn. Regarding the playground equipment, you're not closing it off physically in some fashion. You're just saying stay off, correct?
That's true. We've actually ordered signage that should be here by next week. We're going to start by posting signage in the larger parks. And so our community and regional parks will actually have signage letting people know that the playgrounds are closed at this point. And then as we get more signage, we're going to spread that out to the neighborhood parks as well. Some communities in the country have actually wrapped their playgrounds with caution tape. We're not taking that approach. We're trying to get people notified, and then we are, as I say, we're going to be placing signage next week at playgrounds notifying people that the surfaces are not sanitized.
Thanks.
Another question? We have a question from Lynn, I believe it was with KZUM. When an apartment building resident, if an apartment building resident gets COVID virus, how should the owner handle the situation to help the tenant?
That's a question, Lynn. In order to answer that, it would be based on the particular situation. So each situation varies based on the investigation findings, and we would work closely with the apartment owner to provide the correct direction on how to follow up with that. But there isn't a generalized statement that we can give because each case is very specific and the findings vary greatly. But just be assured that we would work directly with the apartment owner on what safety measures to take. Yes, they could call 8006 number, but actually if there is a positive case, just to remind you all, we immediately begin an investigation and look for the close contacts and where the individual has been and for potential exposure. So we would already be working on that. But the landlord could, or the owner, apartment building owner could contact us as well.
You have other questions?
What's your sense of the compliance with stuff that was issued on Wednesday? You think that it's gone pretty well, that people have really, restaurants, bars, all of that, pretty well complied here?
You know,
I don't have any data in front of me right now, Kent, but I can say this. I think a lot of businesses were already complying with those guidelines prior to them being mandated. And that's part of why I think you see our numbers of confirmed cases are as low as they are right now. I think people started taking this seriously very early in Lincoln and Lancaster County. Of course, you know, taking this next step is hard, and there are folks who were operating and no longer are, and we're doing everything we can to connect them with resources. But, you know, right now it's a lot of anecdotal evidence, and to try to get a handle on compliance, we're standing up a dashboard. And so as people use the Uplink app and report suspected noncompliance, we'll get those reports and we'll, you know, log them. They'll be part of the dashboard, and once they're resolved, that will show on the dashboard too. So that's part of our effort to try to get a handle on the complaints about them. But oftentimes people will think, oh, there's a bunch of cars in a parking lot, they're clearly in violation, when in fact inside the building is it's designed such that there are different spaces and you can keep to fewer than 10 people in a room. So it's a little, you know, appearances can be deceiving. But we still take all those reports of potential noncompliance very seriously.
are there other questions?
Just a quick sort of housekeeping measure. The daily briefings will start on Monday. Is that correct?
Yes.
Okay. I will pass that along to the powers that be so they know.
We know who's in charge of it.
Okay, thank you for that.
Thanks.
Any other questions? All right. Well, we appreciate you tuning in on Friday afternoon to try and get out this important information for our public, and we'll see you on Monday, if not sooner. Thank you.